We call her Isabel the Incredible. She is so kind and caring, but also full of life and passionate. You would never know what she has going on in the background. 2 days before Christmas, when Izzy was about to be 10 months old, she didn't look like herself. We noticed this petechiae bruising. We called the nurse line, and within the first 30 seconds, she said, "Hang up the phone. You need to get to a hospital. This is a medical emergency." Her blood counts were so dangerously low, they needed to airlift her to Rochester. You kind of get exhausted at one point of knowing your child and knowing that there's something wrong, and especially when it's something that you can't see. Every 3 weeks, her body would start to go through this process. She would get the bruising everywhere and she would get really sick. We kept going in, and that's what led them to doing that Adam TS13 test after going through the myriad of things that they have to go through.
It's a really, really rare condition. Isabel is diagnosed with congenital thrombotic thrombocytopenic purpura, or CTTP. At any given time, she could have mini strokes, she could have kidney failures, liver failure, any organ in her body could be affected this at any given point.
We have only been able to create this quality of life for her because of lab testing. And this is a test that you can't get everywhere. It allows us to make decisions on how much medication she should be receiving, because that directly correlates to how long is it lasting in her body.
Laboratory medicine empowers families like Izzy's with knowledge. The testing that's used to diagnose her condition, many other centers only run it once a week. We run it daily because we know that the answers are needed immediately for therapeutic interventions. We're very much focused on taking the diagnostic acumen that we developed within our practice and making it available to patients and physicians outside of our walls. It's all designed around and intended for informing patients like Izzy and her family about what's going on with them.
Dance has been a safe haven for her, away from everything that's happening in her life. She has developed really tight relationships with the young girls that she dances with. It's a community for her, where in a world of this diagnosis, there is not much of a community. Who is Izzy when she is not hooked up to a machine or getting a transfusion? This is who she is.
She knows that what she's doing is gonna help tons of people behind her, like a little bit of a superhero kind of thing.
Mayo Clinic makes it possible for us to have access to lab tests the day that we need them to give the best quality of life to our child that we can. Isabel gives me hope for her future.